Utah's Medicaid program has a serious budget shortfall.
The deficit is significant, and we want to reiterate that at this point, there have been no changes to Medicaid benefits, and people should feel comfortable with using Medicaid.
Utah's Department of Health and Human Services confirms to me it has a big budget deficit. It's so big, the legislature may dip into rainy day funds to cover it.
We are estimating between $100 million and $200 million.
Health and Human Services Commissioner Tracy Gruber says the budget shortfall is a result of a series of factors. Healthcare costs are going up, the COVID pandemic ended, and a lot of people who were on Medicaid dropped off.
We did lose about 200,000 members in our Medicaid membership rolls after the public health emergency ended. And so the question would be, if you lose that number of people, why has it cost so much? The people who remained on Medicaid are what we would consider high utilizers.
There are about 318,000 Utahns on Medicaid right now. The state's share of funding, about $500 million. A forecasting tool used by Utah's Department of Health and Human Services also did not pick up on the budget gap, which is curious given that Medicaid is a highly scrutinized program.
There was no mismanagement, and you're right, the Medicaid program is under a lot of scrutiny from auditors, from finance, but it is a complicated and complex program, and its complexity has really expanded.
Numerous states are seeing shortfalls, and changes are still coming as a result of the big, beautiful bill that passed Congress. Nate Krippus with the Disability Law Center and a member of a coalition called Protect Medicaid Utah hopes it doesn't hurt people.
Will there be, not necessarily cuts to services, but not maybe, not able to expand things or do things that they would like to do because there's less money than anticipated. So I think there's a lot of questions about kind of what this means for the future, and especially with, again, there's going to be fewer federal dollars coming into the state because of the cuts in H.R. 1 passed last year.
The House chair of the Utah Legislature's Social Services Appropriations Subcommittee says we clearly need better cost estimates, and our staff have been working on developing more advanced tools going forward. The good news is that we already had set aside Medicaid-specific rainy day funds to help navigate these unexpected costs. He calls it a vital program for children, pregnant women, the disabled, and the poor who are unable to work, but warrants changes are coming.
We have a serious responsibility to the taxpayers to get this forecasting lined up better with our actuals.
Now, the legislature is likely to hold a hearing on the Medicaid budget shortfall at its interim session next week. On the Hill, Ben Winslow, Fox 13 News, Utah.